Gram stain technique. Developed by Hans Christian Gram in 1884. It is a differential stain, uses more than one stain. Cell wall theory. Gram-positive bacteria has thick peptidoglycan layer with tight cross-linkage, and act as permeability barrier preventing leakage of primary stain and appear purple color. Primary stain color, whereas in case of gram-negative bacteria which has thin peptidoglycan layer and cross-linking is also weak that causes leakage of primary stain and appear as pink color. Counter stain color. Gram staining procedure. Step 1 Primary stain, crystal violet, 1 minute. Step 2 Mordant application, grams iodine, 1 minutes. Step 3 Decolorize, acetone, immediate washing. Step 4 Counter stain, dilute carbol fuchsin. Cover the smear with crystal violet, primary stain and it is a basic stain. Other primary stains are gentian violet, methyl violet. Wait for 1 minute. Wash. Cover the smear with grams iodine, act as mordant. Wait for 1 minute. Wash. Decolorize the smear with acetone for 2 to 3 seconds only, immediate wash. Other agents can be used or alcohol and acetone alcohol mixture. Cover with dilute carbol fuchsin, counter stain. Air dry. Put 1 drop of cedar wood oil and view under microscope, oil immersion objective. Lens 100x power. Modification of gram staining. 1. Kopoloff and Biermann S. Acetone is decolorizing agent and carbol fuchsin is counter stain. 2. Burke S. Acetone is decolorizing agent and safranin is counter stain. 3. Jensen S. Alcohol is decolorizing agent and neutral red is counter stain. Grams iodine. Iodine crystal 1 gram, potassium iodide 2 grams, distilled water. Arrangement. Shapes. Uses. 1. Identification A. Gram-positive or gram-negative. B. Based on morphology cocci or bacilli. C. Based on arrangement clusters or diplo or chains. D. Shape e.g. comma-shaped vibrio, kidney-shaped, gonocochi. 2. Differentiation useful in determining subsequent culture media and biochemical tests. 3. Helps in starting empirical antibiotics in serious infection like meningitis, septicemia. Four. Presence of spore can be determined, unstained area. 5. Presence of inflammatory cells, e.g. pus cells, are indicators of infection. And also 6. Presence of host cells like squamous cell in respiratory specimen indicates poor quality of specimen. 7. Non-bacterial organisms like Candida, trichomonids, Toxoplasma gondii trophozoite, can be identified. Basic stains. Colored compound in the stain are in positive charge, hence bind with negative. Component of cell like nucleus, cell wall, ribosome, e.g., carbol fuchsin, crystal violet, methylene. Blue, it is used as primary stain. Acidic stain. Colored compound in the stain are in positive charge repelled by cell, usually it. Stains extracellular matrix, examples. Indian ink, nigrosine. 10. Bacterial species that cannot be seen in gram stain. 1. Mycobacterium tuberculosis, dye cannot penetrate too much lipid in cell wall. 2. Treponema pallidum, too thin to see, can be seen by silver impregnation method. 3. Mycoplasma, lack cell wall. 4. Chlamydiae and rickettsiae, intracellular, very small. 5. Mordant, grams iodine, used to fix the stain to the cell by forming stain iodine complex. 6. Smears are fixed to the slide by air dry and heat fixation. In addition, heat kills microorganism. 7. Chemical fixatives e.g., methanol, ethanol. 8. Gram-positive appear as gram-negative reasons. Over-decolorization, smear prepared from old culture, excessive heat fixation, cell wall damage. 9. Gram-negative appear as gram-positive reasons. Under-decolorization, thick smear, improper decolorization. 10. Gram-variable, mix of pink and purple cells are seen in same smear. E.g., actinomyces, bacillus, clostridium. 11. Resolution power. Naked eye 0.2 mm, light microscope 0.2 micrometers, electron microscope 0.5 nanometers.